I got a referral from your doctor. Do you know why you were referred to me?
Yeah, I just went in for a checkup and I guess he had some concerns, so he referred me to you.
Okay. Looking over the referral, it looks like he has some concerns over your substance use, meaning alcohol. Did he talk to you about your alcohol consumption?
He did a little bit.
And what did you take from that?
I I don't feel like I have a problem.
Okay. Uh, he did mention that you're a little higher than normal, but today we're going to do an assessment just to see where you're at on a national level, and then also to see where you're at individually, so we can see help prevent the having a higher risk of health issues in the future. So not necessarily you have a problem. It's just to make sure that we're doing preventive care if you're at that point. So do you mind if we do an assessment that might take like a couple minutes? It's just a standardized set of questions.
Sure.
Okay. So I'm going to read you the questions, and then you can pick from the answers I give you. And then I'll score it, and then at the end I'll give you the feedback.
Okay.
Okay, so the first question: how often do you have a drink containing alcohol? Never, monthly or less, 2 to 4 times a month, 2 to 3 times a week, 4 or more times a week.
Probably 2 to 3 times a week.
2. How many drinks containing alcohol do you have on a typical day when you are drinking? 0 to 3 to 4, 5 to 6, 7 to 9, 10 or more.
I normally have about 2 drinks each time, just drinking socially, so.
How often do you have 4 or more drinks on one occasion? Never, less than monthly, weekly, daily, or almost daily.
Rarely, so maybe less than monthly.
Question 4. How often during the last year have you found that you were not able to stop drinking once you started? Never, less than monthly, weekly, daily, or almost daily.
Never.
5. How often during the last year have you failed to do what you normally expected of you because of drinking?
Never.
Okay. 6. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session? Never, less than monthly, weekly, daily, or almost daily.
Probably less than monthly.
7. How often during the last year have you had a feeling of guilt or remorse after drinking? Never, less than monthly, weekly, daily, or almost daily.
Never.
How often during the last year have you been unable to remember what happened the night before because of your drinking?
Never.
Never, less than monthly, weekly, daily, or almost daily.
Never.
9. Have you or someone else been injured because of your drinking? No. Yes, but not in the last year, or yes in the last year?
No.
10. Have a relative, friend, doctor, or other health care worker been concerned about your drinking or suggested you cut down? No, yes, but not in the last year, or yes in the last year?
Yes, because the doctor referred me here, so.
And then the last one, have you ever been in a treatment for alcohol problem? Never, currently, in the past?
No, never.
Okay, give me a couple minutes to pull up your points, and then I can give you your results. Okay, so your results put you in the 4 to 12 range for women, which is considered risky. So you have higher health risk. Um, you scored a 9. So it's not bad. It's not to the point where we have to have treatment, but there is some change that we want to do to be able to lower your consumption. Uh, how do you feel about maybe cutting down a little bit?
I can, try to cut down. I don't feel like I have any health problems because of it, but I can definitely, try to cut down.
Oh yeah, and we're not saying that you're having a problem, but we just want to make sure that we're getting ahead and try to do preventative, because you are considered in a higher risk level. We want to make sure that we can catch this now, where, like you said, there is no problem. Where it could be a little easier for you to cut down, and then maybe see we can do a follow up in a couple of months and see if there's been any changes in your health. What do you think about that?
Okay, I'm fine with that.
Okay, great. I'm really proud of you to make this change in your life. I'm glad you came down to do the follow up. So let's schedule you out for a couple months, and then we can do another assessment and see where you're at. Do you have any questions for me?
No.
Okay. Well, thank you so much. I'm really glad that you came by, and we're going to take care of this issue. Thank you. Impossible.